Hello, everybody. Just welcome everybody to our Thursday community call here, the recorded call. As a reminder, if you do have questions for this, you can gladly send them to the COVID-19 at saukcountywi.gov, COVID-19 at saukcountywi.gov, and we'll try to answer those. So just give you a couple updates here on some of the things that we got coming up. Next week is going to be a busy week for us. We have healthy coping strategies on Tuesday. At 6 p.m., our Human Services Department is going to do a presentation. And with this, we try to do it about a 15-minute presentation and then time for questions. So we want to keep these to no longer than 30 minutes. So again, there'll be healthy coping strategies next Tuesday, January 19th, 6 p.m. We will be sending the link out for this on Nixle. It will also be on our website. So we would encourage you to spread the word and to join us Tuesday evening. The other thing we've got going on next week, Thursday, this is really exciting for us. We've worked with the 3 hospitals, Reedsburg, Sauk Prairie, Baraboo Hospitals, and Public Health to come together as a team to talk about the vaccine and questions that individuals might have, some of the hesitancies you might have related to the vaccine. And this is going to be a live press conference where the public's involved as well. You can, again, send your questions to COVID-19 at saukcountywi.gov, COVID-19 at saukcountywi.gov ahead of time. And what we will do is we will try to address those questions. So there's going to be a presentation. This is going to take a little bit longer. This is an hour total. We have some great panel members, medical doctors from the hospitals, some of our great public health staff that are going to be on to address certain topics, and then leave it open where individuals can put questions into the chat, or if you've sent questions in ahead of time, we will address those. So another great opportunity as we continue on, and there's going to be a lot of great information here today on talking about vaccine stuff, but this will be a great opportunity to really get those detailed questions that you want to ask your medical provider but have not been able to get in there. So we encourage you to attend that. That again will be January 21st at 5:30 p.m.
Hi, everyone. This is Jessie Phelan from Public Health. Just wanting to remind you of our testing sites that we have available each week from our local area partners, and you can refer to our website for the specifics. They're also on your screen there. And just a reminder as to who should get tested is anyone who's got COVID symptoms, anyone who's had close contact with someone who tested positive for COVID, and then those of you who have regular exposure to lots of folks in the public, such as working in grocery stores, restaurants, things like that. And just an update too, that currently the lab turnaround time, we are getting about 79% of our positive cases back within 48 hours. So that is a bit of an improvement. So you're getting results faster now. So.
Okay, thank you, Jessie. We're going to move on to our COVID-19 vaccine update then. One of the things that we're getting the most questions on is the vaccine prioritization. The Wisconsin COVID-19 vaccine program is following the Advisory Committee on Immunization Practices and the Wisconsin State Disaster Medical Advisory Committee guidance about priority groups for COVID-19 vaccination. So they're the ones telling us who can get vaccinated when, pretty much. So at this time, we are in phase 1A of the vaccine prioritization guidelines, and we are working on frontline healthcare workers as well as skilled nursing facility staff and residents. One of the things that we understand that you may be hearing about in the media is that others are beginning to give the COVID vaccine to those outside of phase 1A. We want you to understand that Sauk County Public Health will continue to follow the federal and state guidelines as I just stated, as we determine who gets the vaccine. We currently are receiving a very limited supply of the vaccine, and we are working on getting this into the arms of all of our healthcare workers with the highest risk of exposure, which are again phase 1A. We are not taking any waiting lists for the vaccine, and we do ask at this time that you refrain from calling your local healthcare clinics or public health to ask specifically about when it is your turn for the vaccine. As we move into these next phases, we will let our community know, excuse me, as we receive state and local guidance as to how we move into the phases, we will be communicating these changes using newspaper, radio, television, social media, our Sauk County website, as well as Nixle. If you are not signed up for Nixle, this is a great way to receive alerts on your phone for all emergency issues. So to sign up for Nixle, please text your zip code to the number 888-777. And again, we really, really thank you for our patience as we all work together to follow these guidelines and vaccinate all of our Sauk County residents. And those are the vaccine updates that we have at this time. Jeff, do you have anything else that you would like to add?
Yeah, I got a couple other things just real quick. Law enforcement and fire were added to the disciplines that will be able to be vaccinated now. So in the county, we will start that next week. So starting January 18th, 19th, in that time frame, we should be starting to vaccinate law enforcement and fire. And just a little bit of a background for the public here, how this all gets coordinated. We have a call on Mondays with all the individuals, all the different agencies within the county that have been approved or are awaiting approval to be vaccinators. So it's hospitals, it's EMS, some of the EMS providers, and some of the pharmacies within the county. We get together and we really go through as a team who's going to take what discipline, who's going to do what area, like a division or geographical location throughout the county. So for example, when the fire and law came out, that group got together and we went through it. So our intent will be as phase 1B, the rollout comes, the draft document is out right now. As we get that, we'll start working together as a team to look at who's going to take care of the different disciplines that have been identified. And we will continue to work through that through the COVID process, working together as a team. We really understand that this needs to be a coordinated effort. We do not want duplication of effort. And so these providers that are out there that are doing these things have been just a tremendous resource to assist us in getting vaccine into the arms of folks from our wonderful Sauk County.
Okay, and we also this morning received an update that Wisconsin DHS has created a sign-up form for a weekly newsletter just to keep the public informed of COVID-19 response and vaccine progress. So we'll put the link up. The link is up here where you can sign up for those email updates directly from the state as well. And with that, we'll shift on over to our data update, and we're going to start with our vaccine data. So as Jeff and Jody have shared, we have started vaccinating that phase 1A category. So that's the frontline healthcare workers and skilled nursing facility staff and residents. And so far we have administered 2,259 doses of COVID vaccine to Sauk County residents. And give me a second here. We're going to change our screen over to the data hub and we'll do an update on our 14-day data. So the data hub has been updated with the 14-day data. So we'll just do a quick overview for you. As of today, Thursday, January 14th, we're at 4,813 confirmed cases. There are currently 219 active cases, and there have been 4,561 cases recovered. Total 181 of those confirmed cases have ever been hospitalized, and unfortunately we have had 31 deaths of confirmed cases. We have also added last week to the data hub our probable case data, and again, a probable case is somebody that doesn't have a PCR or a molecular test, but does have a positive antigen test, or they have symptoms after having close contact with somebody with a confirmed case of COVID, or if COVID-19 is listed on the death certificate. So those are the probable case definitions. And in Sauk County, we've had 223 probable cases. We've had 6 deaths of probable cases, and 4 probable cases have ever been hospitalized. And you can see on the data hub our cases over time. We are unfortunately starting to see that our green line of our average cases per day is moving in the wrong direction. As of today, the average number of cases per day over the past week was 26 cases per day, and back earlier, last week, so on January 7th, which would have been 7 days ago, that average number of cases per day was 19. So unfortunately, we are seeing that average number of cases per day shifting from a steady downward trend to a flattening and even in some cases an upward trend. So we're really monitoring this. I'm hoping that this is just a little blip and this will continue to keep going back down, because ideally we would like this, our average new cases per day, and this green line to be below this 5 cases per day line. If we get below this 5 cases per day average line, that would take us out of the high case activity levels. We're actually going to skip on down now to our surveillance data. And remember that the data hub has a lot of information on it, so it is slow to load. Please be patient with it. But I wanted to hop down because we've had a couple of status changes in some of our metrics. So if you look at our list here, we have our COVID case activity is in the red. Our influenza-like activity is also in the red. And then we have a couple other metrics here in the yellow and our tests conducted in the green. So I'll just go through one by one really quick. So the first chart that's in the surveillance section here, remember that you can, through this dropdown, pick Sauk County, and then it will populate the fields with Sauk County data. So our case activity remains in a very high level. We had 350 cases during the 14-day reporting period, which gives us a burden of 558 per 100,000. So that burden per population. And we had a no significant change trajectory. So that leaves us in that very high case activity level. When we look at our percent positivity, that remains in kind of what we consider the yellow zone. So our 7-day was 8.5% positivity. When we look at over the 14 days, it's 8.4, which unfortunately is an increase from last week's report where we were in that 7%-ish range. So seeing that number go up isn't really where we'd want to be, but we are still remaining below 10%, which keeps us in that yellow zone. Another good thing, though, is that our COVID-like illness activity remains in the yellow. So that for the second week in a row now has been a medium activity. So we are starting to see less people visiting the emergency department with COVID-like illness. So these are the people that do not have an influenza diagnosis, but have upper respiratory symptoms visiting Sauk County emergency departments. Now, unfortunately, our influenza-like illness, so these are the individuals that visit with the respiratory illnesses and receive an influenza diagnosis, that did in the past 14 days increase, and we are currently at an elevated activity. So this puts us in the red for the influenza-like illness activity. We had 1.8% of our emergency department visits be for influenza-like illness, and that is above our normal range of 0.7 to 1.3%. So that information, we really don't like to see that going up into the red either. So hopefully we can get that to go back down as well, but we'll continue to monitor that. If you scroll a little bit further down on the data hub, our tests conducted. So we did have more tests in the last 14 days. We're now averaging about 311 tests per day, so which is better than where we were last week. However, our testing level still is lower than it was in November, where we were averaging 510 tests a day. And in December, we averaged 416 tests a day. So we really would like to see that testing level go up, especially knowing that our percent positivity is in the yellow. That lets us know that we're not catching every single positive case, because that testing is above our 5% baseline that we're kind of aiming for. So please, another reminder, if you have even one symptom, go get tested. If you have been exposed or you think you may have been exposed, please go get tested. And if you're somebody that is exposed to a large number of people every day, so if you're a restaurant worker, a grocery store worker, please go get tested. And testing, again, is how we're able to contact individuals that test positive so that we can ensure that they're able to get isolated so that we can stop the spread of this virus. Also related to testing, our timeliness of our lab reporting is improving. So last week it was 71%. This week up to 79% of our positive tests were received within 2 days of that test being conducted. So having that faster turnaround time allows us to contact positive cases quicker so that they can get isolated quicker and can contact their contacts so that their contacts can quarantine, again, slowing the spread of the virus. Also, with the decrease in cases, we're able to conduct interviews for more people. So total 83% of new cases have an interview recorded. 81% had that interview conducted within 1 day of us receiving their test results. So still in the yellow. We'd really like to get this up to the green, be above 85%, but this is an improvement from where we were in November and early December. Now, we are able to contact a lot more cases, but we're still not able to contact all of the cases. So if you were tested at your medical provider, then your medical provider will be the one that will contact you with your test results. If you were tested at a community testing site, then Sauk County Public Health staff will be contacting you with your test results. And then the other metric that changed, which is kind of exciting, that changed from the red to the yellow, is our community spread. So in the last 2 weeks, 26% of cases with completed interviews did not know where they could have gotten COVID, so they weren't linked to a known source case, and that moves it into the yellow since it's below 30%. Now, ideally, we would like this to be below 20% so that we could link more cases, but this is a great move for us to be moving out of the red and into the yellow, and I'm really hoping that that's able to stay there. Now, also included on the Data Hub is additional demographic data about the confirmed cases and also the probable cases. So that is in these sections. So you can see the ages of confirmed cases, the ages of confirmed cases that were ever hospitalized. Just hover your mouse over, it'll give you more information. You can see the ages of the confirmed case deaths. And you can also see for the confirmed cases, our severity index. So we are starting to see, kind of trending that we've seen over the past few weeks is that the number of moderate cases is increasing. So overall, 39% of COVID cases are what we are considering moderate. So that is somebody that experiences symptoms that are concerning enough to them that they seek medical attention and they receive outpatient medical care. The severe cases, so these are the ones that are hospitalized or the ones that unfortunately lose their lives to this virus, that's staying about 4%. And our asymptomatic cases are about 7%, leaving 50% of our cases are mild. So these are the ones that experience symptoms but are able to recover at home without medical attention. And then we also do have race and ethnicity data for our confirmed cases. And so you can see that there continues to be a disparity in the number of cases and the number of hospitalizations for our Hispanic and for our Native American Sauk County residents when you compare those percentages to their representation in the Sauk County population. And then if you scroll down a little bit more, there is also the probable case demographic data. So you can see the increase of those probable cases over time. Again, the more recent increase is because of the availability of the rapid or antigen tests. And if somebody tests positive with an antigen test, they're considered a probable case because those tests are not as sensitive as a PCR test. So you can see that there, just hover your mouse over for those cases. And then we also do have posted the ages of those cases, the ages of those cases that are marked as hospitalized, and also the ages of the probable case deaths. If you have any questions about the data, or if you have questions about COVID in general, please email them to covid19@saukcountywi.gov, and we'll be happy to get back to you, and we may even feature your question on an upcoming vlog, so one of these weekly calls. Thank you for tuning in and for watching all of our weekly updates. We really appreciate and hope that the information is helpful to you. So if you have any feedback, you can also send it to that COVID-19 at saukcountywi.gov email. And we encourage everyone to please stay safe and stay healthy.